So this really puts on one slide the states that we have, that we've been talking about across the South, where we have our greatest concerns. The two top states with the largest increase in test positives are Texas and Arizona, followed by Florida, Mississippi, South Carolina, Alabama, Georgia, Louisiana, Nevada, and Utah. Those last few states are under still 10%, but we're tracking them closely as we look at that individually. Finally, next slide. You can see on this slide, we are tracking, and this is when you hear about we have a certain 2% or 3% of the counties under specific alerts. So it doesn't matter the size of the county, we're tracking the increase and the rate of increase of new cases at the county level. We currently have about 130 counties out of the 3,100 in the United States in that category. Next slide. Metro level, this shows you the case positivity by the metros and the number of tests that have been done. Next slide. And then this shows you specifically the change over time of test positivity in the largest metros where we have concerns, and this is Austin, Phoenix, Houston, Dallas, San Antonio, Tampa, Orlando, Miami, Riverside, California, and Atlanta at the bottom. And so this is how we continue to integrate data on cases, data on testing, and data on hospitalizations so that we can work with the states for a comprehensive integrated response. Next slide. I know many of you would be interested in seeing how high the test positivity rate became in April and March and April. So that top line is New York City Metro, and you can see it reached over 50% on a series of days for almost 2 weeks. 50% of the tests were positive for COVID-19. Underneath that, you see New Jersey and Minnesota and a whole series of individuals. Detroit is the second large mountain. Next slide. So quickly to show you how we look at this at the state level and work with the governors and the local health authorities. So this is Florida. We track testing, it's done, the number of test positives that are in the blue line, the total number of cases seen in the black bar, and what we call the syndromic presentations of early respiratory diseases and pneumonias. Next slide. This then, we look at the county level to look for changes in the slope of the number of new cases. So you can see that top county that has the largest increase in slope in cases is Miami, Miami-Dade, followed by Broward and Palm Beach. All the other counties are much lower in their daily case increases. This allows us to focus resources and testing along with the state into these specific sites. Next slide. That all comes together to create this graphic so that individuals can understand and we can understand precisely what the rate of growth is and where the rate of growth is occurring by the shading of the boxes. Now I'm going to quickly take you through Texas because it's the same story. Next slide. So this shows you the exact same graphics now shown for Texas, showing a continued rise in the daily tests performed, but also a rise in the test positivity, the blue line. You can see throughout May, after opening, their test positivity continued to decline as their testing increased. It was in the last 2.5 weeks that we saw this inflection of rising test positivity along with rising testing. But it was the increase in test positivity that alerted us, along with the increased cases, that this was becoming an alert. You can see in the red boxes, everything is heat mapped. So at a glance, you can tell those two boxes that are in the middle that are red, that's the heat map showing that this has rising cases and rising test positivity. Next slide. But even in Texas, next slide, please. And this gives you a map of Texas that shows where the cases are and where they're rising the most rapidly. And finally, I'm just going to go through Arizona very quickly along with California. So next slide. Same situation that we're showing here with Arizona, rising number of tests being performed, but also rising test positivity, rising cases. Next slide. Arizona is unique, and they have essentially one county that is primarily represented by the depth of the new cases, and this is in the Phoenix area. Next slide. Then next slide. So this is California. And so you can see California over the last week has had that increase in test positivity. You can see that dramatic increase at the end of that bar in the blue line, along with still increasing testing that has been done. And we just want to thank all of the governors and all of the work at all the laboratories that has allowed us, along with HHS and Brett Gerard, who ensured that the supplies were there to really increase these orange lines. You could see in each of these cases, these orange lines have dramatically gone up over the last 4 weeks. Next slide. And like New Mexico, the primary infections right now in California at the highest level are in the LA area. But because LA is a large metropolitan area, next slide, you really need this kind of more specific and local graphic to really show that it's also increasing in the Central Valley. And this gives us the ability to focus resources among agricultural workers to improve testing and isolation for those who become positive. So I just wanted to take you through how we've been looking at data, how we consolidate that data, and then Monday report it out to the governors. We hope over the next week to be able to really have this data available in real time on the White House website so that everybody across the country can see where the cases are. Because in the end, we really want to call to action. When we started talking about what can be done, we said the most important thing that would change the spread, and I'm going to turn that over because I know Tony's going to talk about it, is really individual behavior and our respect for one another through social distancing, wearing a mask, and ensuring that we're protecting the most vulnerable that may be in multi-generational households. And I just want to end by thanking again the millennials who have come forward. And I know during the protests we asked a lot of them to go forward and get testing, and we see those testing rates really improving in the under 40 age group. That is going to be important to continue to accelerate testing among the under 40 age group because that's the age group most likely to have asymptomatic spread.